So I want to offer some food for thought around working with trauma clients and countertransference. Now, countertransference happens whether it's a trauma client or a regular client. And it's never a question of if it happens. It is always a question of when it happens, because countertransference is a normal, common occurrence for therapists, and it's also common with trauma. So one of the things that I like to share when we talk about countertransference is what I call the experienced swimmer. There are several swimmers that are associated with countertransference. So let me explain. So what happens for our countertransference is it's like we are watching a client in the water who's thrashing around. The waves are coming at them. The emotion is strong. There's often a sense of fear and worry and anxiety. And when we see that, sometimes it provokes different types of swimmers in us. And so when we see the client in distress and in all of that wave of emotion and worry that they're going to drown, sometimes it provokes in us what I like to call the lifeguard. And this is that hero, I can save you, let me go out there and grab you out of the water and bring you to shore. I saved you. You just rely on me. I've got this. While that sounds heroic and savior-like and wonderful, that's really not the best approach with a client. And the reason why is because the lifeguard, it steals from our client. It steals their opportunity to grow, to learn how to swim, to understand how to handle the waves and the struggle on their own. And that's not our role, is to steal from them that opportunity. So I can tell you right now, that's really not where we want to be as a lifeguard. The second kind of swimmer that often comes up is that when we see that client in the distress and all in the waves, the second person that comes up is what I call the land lover. And the land lover says, oh, God, that sounds painful. That sounds like an emotional roller coaster. I don't want anything to do with that. I'll stay on the land and I'll scream to them out there and say, hey, you're going to be okay. I'm not going to get close to you, because one of us needs to be rational. And if that's the case, no feelings. Unfortunately, what happens is the land lover, it doesn't give the opportunity to the client to feel like someone's there with them, willing to be beside them, that's not scared of the emotion and not scared of the distress. So that one often is not very effective. Sometimes that can come off as cold or very distant. The third countertransference response that often comes up is what I call the tandem swimmer. This is the one that swims out to the client and says, hey, I'm here with you. But because the tandem swimmer hasn't done their own work in the water, hasn't done their own work with their feelings and their emotions, they can't handle getting close to someone else's. So when they go out there, they drown with the client. They get too wrapped up in their own feelings and their own emotions, and they in themselves also become in distress. What I'm encouraging you to do when it comes to countertransference is to work on your stuff and to work on minimizing your own response to some of these stories that our clients tell that bring up feelings of inadequacy or pain or feeling betrayed. So there are so many things that we can work on as counselors to make sure that none of these countertransference responses ever come up. Instead, I want you to be an experienced swimmer. Go out there with the client, be right beside them, let them know that you're there, but encourage them to swim. Encourage them to learn what works for them. Encourage them to try something new, to take a risk, because you're right there with them. That's an experienced swimmer, and that's much more effective when you're dealing with countertransference. I hope this helps.